My name is Kristen Wheeler and I'm a first semester nursing student. It is 9:30 in November the 17th, 2016, and I'm going to be inserting and removing a NG tube today. I would come into my patient's room, check 2 patient identifiers, and then I would also assess my patient for mental cooperation as well as if they have a gag reflex or anything like that. I would then go ahead and perform hand hygiene and then set my patient up into high Fowler's, which I have already done. I would go ahead and get all my tubing ready, which I've already done too. I have measured from the nose to the ear and then down to the xiphoid process, and then I would mark it with tape so I know how far to insert it. I would then go ahead and place on non-sterile gloves at this time. I would go ahead and lube the tip of the NG tube and give my patient a drink and tell them to go ahead and take some sips while I'm inserting it to help get the tube down easier. I would hyperextend the patient's head and insert my tube. Once it gets down to the oropharynx, I will go ahead and tilt my patient's head back forward, and then also turn my tube 180 degrees to help it get down the tube a little easier. Once the tube is completely in, I will go ahead and check to make sure that it is in the correct place. I will aspirate it and then check the secretions on the pH paper, and it should be 1 to 5 on acidity. I could also check by getting an x-ray done or by inserting 10 to 30 milliliters of water and listening for the whoosh over the stomach. At this time, now that I know that it is in the correct place, I will put on the tape. And I would also pin the NG tube to the patient's gown just to make sure that there's a little less tug on it. At this time, I would go ahead and attach it to the suctioning. And now that I've inserted it, my physician has ordered to remove it. So I would go ahead and wash my hands again and place on non-sterile gloves. Remove all the tape, and then ask the patient to take a deep breath while I remove it, and then just slowly pull the NG tube out. After that, I'll go ahead and get rid of all my supplies, lower my patient down out of the high Fowler's, and then document my findings.